Yes, Co-Chair Galloway. Board Member Dandy Evans,
Here.
Board Member Anyana,
Here.
Board Member Hegstrom,
Here.
Board Member Cotter,
Here.
Board Member Saketa,
Present.
Co-Chair Lee is absent, and Co-Chair Galloway. So we do have quorum with Board Member Co-Chair Catherine Lee absent.
All right, next we can go to the agenda review modifications.
Does the board have any modifications they would like to make to the agenda?
No?
Okay.
All right, and next we have a report from the department today.
Yes, we do.
How's everybody doing today?
We had minutes. Were we supposed to approve the minutes?
That's under the consent calendar.
Sorry.
How's everybody doing today? We're going to start off with just a little recap of some of the things that RDCY has been doing and some of the events that we've been going to. The first one was the MLK Day of Service. We have the Snowball Scholarship, the Snow Day at Nickel Park, and for the upcoming events, we have the Holiday Egg Hunt, which will be March 23rd. Then later, I'm going to pass it over to Nick to talk about the new co-chair selections. First, I want to talk about the MLK Day of Service. It was on January 15th. It had over 300 volunteers from the local colleges, community organizations, just city volunteers. There were some sororities out there. They had vendors. They were giving free food out to the community, free plants, free vegetables. And the whole thing about was just unity and the community coming together to make Richmond a better place and to beautify it. It ended with a memorial program for Dr. Martin Luther King and just honoring his legacy and everything that he stood for. Then we have the Snowball Scholarship. It was the 71st Snowball Scholarship. Applicants all over WCC USD were able to apply for it. They ended up choosing one king and queen, and they had about 4 or 5 co-queens, I believe, and then they had 2 that were men. So I like the fact that they were able to give everybody scholarships to help those the youth of the community pursue their college careers. And last but not least, we had the Snow Day at Nickel Park. This was amazing. This is the second year that Richmond has done this. Actually brought the snow to Richmond. It was a very nice event, had a big snow hill. Santa Claus was out there. The Grinch was also out there, so you had to be careful. It was a full day event. Of course, it was food, vendors, and it was just nice for the community to come together and do something Christmas themed, I guess you can say. I'm gonna pass it over to Nick for our co-chair nominations.
Good evening, Oversight Board. Nicholas Delgado, Department of Children and Youth. I wanted to talk for a second about the co-chair nominations. I know that we had this process this past year, and so we're going to be beginning this again at our next meeting on March 4th. It'll be our regular meeting in March. And so the process, just to recap so everyone's aware of how we're going to start the meeting on March, is that we're essentially going to sit everyone down. We're going to have an item where you will each have the chance to nominate someone. All applicants must be nominated by a fellow board member. It will not be a self-nomination. And then you all will have the chance to vote either yes or no, either for or against electing that co-chair. There will be one position available for someone who is a youth sitting board member and also one who is an adult sitting board member. Yes, of course. There's nothing in our bylaws that state you can't do a second term.
I would just like to state a couple things. One is that the ECIA grant was released in December of 2023, and it will be due on currently Friday of this week, but just for a heads up and promise not to tell anybody. But we're going to send an email out tomorrow saying that it's going to be extended through the weekend because we're not going to do anything with it at 11:59 on a Friday. So I think it'd be best just to give people as much time as possible. So tomorrow we'll be sending out a notification saying, hey, you have an extra 2 days. Just a reminder, the ECIA grant is going to be due on Sunday. I think we may make it actually Monday at noon just give people as much time as we can when we'll actually put our hands on it. So that's a heads up. So if you know somebody that is interested or thinking about applying, so we have our standard ECIA grant application, which is awards from 10,000 to 50,000, and then we have our ECIA mini grant, which is $5,000 or $10,000 grants, and those are limited to programs or services that are be provided at city-owned facilities, so community centers, recreation building, any of our public parks, and so just want to give you a heads up and just remind those that may be interested in applying that it'll be due. I think we're going to make it Monday at noon, so we'll give people more than 2 days, just as a heads up with that. And okay, we'll go to consent. Oh, public forum. So we do have 2 submittals for public forum. One came from Cordell Hindler. He submitted via email. He says, hello, Patrick. I'm submitting the following comments into the record. The Oversight Board is invited to the 100th anniversary dinner of the Richmond Chamber of Commerce this Wednesday at Laura's Fine Dining, 6 to 8 p.m., $65 per person. His second comment is also the Richmond Rotary Club weekly is Friday the 16th at 12:30 p.m. at the Richmond Country Club, $25 for lunch, and he shares Joe Sanger will present on the Make-A-Wish Foundation. And sincerely, Cordell. We also have a comment from Venice Robinson. Venice says, greetings, my name is Venice Robinson, and I serve as the Operation and Communications Manager at Early Childhood Mental Health. I was reviewing the board packet that you presented today and would like to touch bases and see if there's a possibility to implement early childhood mental health as a stakeholder for this project. Consider we are on the end of applying for grants from the city. I'm not sure if that eliminates us from stakeholder position. I know the Seneca's listing as well as Family Justice, and consider we provide similar services in our very own city and have been providing these services since 1974. I wanted to see how our agency could be more involved if that option is available. Our agency provides services that immensely impact our community from mental health support, family support, licensed didactic therapy, early education services, and much more. As I recently have taken on this important role for the agency, and as we reach 50 years of service to the Richmond community, I would love to be able to connect and build a relationship with RFCY, as building our youth community is something we both have in common. I hope I can connect with you all soon and discuss how our agency can be more involved with the amazing work you are doing in our city. She says, in community, Venice Robinson. And so I think that it concludes our public comment.
Thank you, Patrick, and thank you for everybody who provided public comments. We're going to move on to item E.
So is there a motion to approve the consent calendar?
Correct.
And is there a second?
I'll second.
Okay. So I think I have Hegstrom and Inyana. Okay. And we'll do a roll call. Board Member Dandy Evans. Motion to approve consent.
Yes.
Okay, no worries. Board Member Inyana.
Yes.
Board Member Hegstrom.
Yes.
Board Member Cotter.
Yes.
Board Member Saketa.
Yes.
And Co-Chair Galloway.
Yes.
The consent calendar is approved unanimously.
All right. Now we're going to move on to item F1.
Item F1 is to receive an introductory presentation from Public Works and listen to an update on the Community Needs Assessment and Strategic Investment Plan. And so at the end of last year, we did a solicitation for, well, not the end of last year, we approved the solicitation for our Community Needs Assessment and Strategic Investment Plan vendors, which is Public Works Incorporated, and we have some representatives here tonight to share. So should they be? Oh, so you all could sit there if you'd like. Oh, okay, okay. So there's a slide deck, but I will let them introduce themselves. But just for your information, we have Eric Schnurr, Christy Guillory, and Jeanette Sanchez from Public Works. And they're going to share kind of what their process is going to be for the needs assessment. And then we're going to actually solicit some input from you all in some exercises around youth and needs, et cetera. Okay?
Ready to go? All right, thanks. Pleasure to be here tonight, and we have the slide presentation up. My name's Eric Schnurr. I'm the president and the founder of Public Works LLC. And go on to the agenda slide here. This is a quick overview of what we're going to cover in the presentation today. And I think the main thing I want to point out to you is just the last item, which says questions. Of course, we want to field any questions you've got and make sure you know everything about the project, but we also have questions for you that we'll be doing at the end of the presentation, because the main thing that we want to get is input from as many different sources as we can get, and that includes all of you on the board tonight. So we have a kind of structured question period we'll be going through when we finish giving you an overview of the project and where we're at in it. Okay, on the core leadership team. Is that right? Yes, all right, I went ahead to it. Just to give you some quick background, Public Works LLC has been around for 30 years now. We're headquartered in Philadelphia, outside of Philadelphia, Pennsylvania. We've worked all over the country, including a number of projects here in California. We've worked for about a dozen California state agencies. We've done several projects for Los Angeles County. We've worked on a couple of different projects for various communities in Southern California, and most recently we wrapped up a review for the Oakland Unified School District late last year. It's a pleasure to be here in Richmond. We have 3 team members here for the week for an on-site visit. There will be several others coming out over the course of the next couple of months who you'll have a chance to meet. 3 of us are from the Bay Area. I grew up across the bridge in Marin, and Jenny Wall, who's listed here as our deputy project manager, has lived in the Bay Area for the last 20 years. And Jeanette Sanchez over there is a native of Richmond, California, and is particularly happy to be back here working on this project and helping her hometown. And in fact, she's sticking around after the rest of us go home from this week because she still has family here, and this is a chance for her to spend a couple of days with the family. So we have Richmond and Bay Area roots on this project, as well as nationwide experience working on a range of public policy projects for state and local governments around the country. The third person with us tonight here you will also be hearing from is Christy Guillory. Christy was a presidential management fellow early in her career and worked at the Federal Office of Management and Budget, and then HHS, if I'm correct, in HHS for a range of national organizations, and we're happy to have her consulting with us nowadays. I think that's the main thing I'll cover about our team. You know the core leadership team from the city, and of course we've listed all of you here, so I don't think I need to introduce you folks. Okay, give you a quick overview of the project. Go on to that. I'm going to do this slightly out of order, despite the fact that they're numbered in order. As you know, this is a community needs assessment and then a strategic investment plan based off of the needs assessment. So quite simply, what we're going to do first is assess needs, basically through a combination of primary and secondary research, look at what are the needs of children and youth in Richmond, and then also assess what are the existing services to meet those needs. And of course, the difference between them is the gap and the gap analysis, which then leads to some idea of, well, what needs to be done to address that gap, which is the strategic investment plan at the end. I started there so I can circle back to you to number one. engaging the community. We try to have stakeholder and community engagement as a heavy part of every project that we do, even when we're working on state government organizational issues, because we think it's important to hear from the voices of the people who are served by the government. So this is an important part of just about everything that we do. We've developed a lot of methodologies for reaching out to people and hearing from people. But that's an especially important part of this project for two reasons. One is it's very much about the communities. We want to hear from community. And secondly, as you all know, community input is in the Richmond DNA, and that's been driven home to us very clearly and very strongly. This project is really structured heavily around stakeholder engagement. And we'll go through now the timeline of the project in a little bit more detail. And number one on this timeline is community engagement. And then when I'm done, Jeanette is going to give you an even deeper dive on what we're doing in terms of stakeholder engagement. So you can see that over the course of the next 3 months, we'll be reaching out to members of the Richmond community in a wide range of ways. We started last week on interviews long distance. We're here all this week doing a range of interviews with community organizations and individuals to get a sense of the needs here in Richmond. We'll be continuing for the next roughly 2 months in a further series of interviews, both in person and long distance, culminating in a number of focus groups that we'll be doing back here on the ground the beginning of next month. We also have a fairly sophisticated survey system that we use that will be open to all members of the community, and we encourage you to encourage everybody you know to join in and have their voices heard. And this will allow people to answer questions in a structured way to provide their insights on what exists and what's needed and what do they see as what needs to be included in this plan. The last one of these that we did on a affordable housing project in Maryland this summer, we received responses from 2,000 members of the community. So this is a real opportunity for people to weigh in and have their voices heard. All of that will culminate in a visioning event in April, which is open to the community, and people are invited to come and help have their voices heard live and in person, and I will describe that in a little bit more detail. That all culminates in a report that summarizes everything that we've heard from everybody. We can go on to the next slide. The second main strand of this then is consolidating everything that we learned from the primary and the secondary research, the primary being the stakeholder engagement basically, into a community needs assessment, a formal report. You can see here the schedule for the draft report and the final report, and then we can move to the next slide. And the ultimate product is the strategic investment plan based on the assessment of needs and the community need assessment. As you can see on this schedule here, running parallel to what we're doing with the outreach to people through focus groups and interviews and surveys and so forth, we are concurrently doing research and analysis, development of metrics, and all of that culminates in the second report in the strategic investment plan in May. We can skip to the next slide. Building off of both of the preceding slides about the development of the CNA itself and then the strategic investment plan, once those are developed and handed in to the city, they will be given to you, and we're going to be coming back to meet with you and hear from you on both of those products before everything is finalized and the project is done. I think that's, let me see what comes up next here. Yes, okay, now I'm going to hand it over to Jeanette, our Richmond native, to, okay, so sorry, you'll get Jeanette later. Christy will give you more detail here on stakeholder engagement.
Good evening. Again, I'll just introduce myself just for ease. I'm Christy Guillory. I am one of my role in the project is helping to lead stakeholder engagement, and I'll go over our approach for stakeholder engagement, talk about some of the stakeholders we have engaged and plan to engage, and also talk about some of the focus areas and priority populations that we will be using as we conduct our engagement. Next slide. In terms of our approach, it could be summed up in a quote: "Nothing about you without me," which simply means if it concerns you, you get input. And basically insert, you can take out you and put the citizens of Richmond. We want everyone to have, to the extent possible, we want to get input from as wide a variety of organizations and individuals as possible as we conduct our engagement to really understand the needs of the children and youth in this community. For us, it's all about partnership. We want to be a true partner with local organizations in Richmond and understand and gather insights and collaborate with them and understand potential solutions. And what do they really feel about the needs of the youth of Richmond, and how do they see organizations being effective partners? But one thing we'd like to say at the outset is this needs assessment will not simply be a repeat of the needs assessment that was conducted in 2020. Of course, we will build upon it, and it is a wonderful resource, but we want to validate that data, update that data, and build upon those past findings as we look forward to the next couple of years. And some of the things that we will use, discoveries as we dive a little bit deeper in this next building upon this next community needs assessment, we really want to look at the underpinnings, the social determinants of poverty, and how this affects population groups in Richmond. We will also be collaborating with WestEd as they conduct their evaluation. We really want to be a partner with them because many of their activities are running in tandem with the activities that we're conducting. In terms of increasing in the tools we will use to increase and maximize participation in our surveys and focus groups, we will offer incentives to generate a high response rate. We're also, as Eric alluded to, we will be conducting a survey. This survey will be used to gather information from service providers, grantees, relevant city department staff, public and private sectors. And we'll also be looking at something called the Child Opportunity Index. Next slide, please. This index will be used to assess, for us to be able to assess how children and youth are faring in Richmond. This Opportunity Index was actually developed at Brandeis University, and it's an index of neighborhood features that assess how children are developing in a healthy manner. And it looks at several domains, including education, health and environment, and also social and economic factors as well. And it looks at 29 neighborhood level indicators and develops a single composite measure for nearly all U.S. neighborhoods. And this is another aspect of our stakeholder engagement strategy to use this Child Opportunity Index. Next slide, please. Here are a few of the focus areas that will guide our stakeholder engagement. But before we get into these, just wanted to say that the last community needs assessment identified several needs and priority areas. And again, I want to reiterate that we're going to build upon these areas as we look toward building this next community needs assessment. There are various focus areas and focus populations. And I'm not going to read all of these out loud, but again, some of the focus areas: health and well-being, education, information, case management, youth violence prevention, environmental health, and the populations, all the population. We're going to try to speak to individuals that deliver services as well as individuals themselves that are in some of these focus populations: the unhoused, LGBTQ children, youth with physical, mental, behavioral challenges, system-involved youth, children in poverty. So just to show you, we're casting a wide net so we can make sure that we are covering all of our bases to truly understand the needs of youth in this community. And here's a snapshot of our key stakeholders. And I would like to say that many of these groups we either have already started conducting virtual interviews. We have a robust week. We have a hectic week planned where we spoke to several groups today. We'll be speaking to many groups while we are on the ground this week, and we're also going to be speaking to more. But just wanted to give you just a quick snapshot of who we will be reaching out to. For instance, today we actually spoke with individuals at the practice space, and we conducted an interview with Things That Creep. So again, casting a wide net. Next slide. Oh. And I think at this point, I'll be turning it over to Jeanette.
Hi, good afternoon. So we are currently talking to key stakeholders on site. We've talked to a few virtually last week, and you just saw the outline of the different phases of our project. We also know, however, that West Ed is conducting a project too and speaking to grantees. Because we want to be sensitive to two consultants working right now, talking to a variety of community stakeholders at the same time, we thought that it would be helpful to review a little bit what our goal is and the different ways that we're going to be working collaboratively with West Ed for the next 6 months, so that we can share information, we can be strategic of how we're speaking to the community, what questions are we asking, and how can we just both help each other stay informed to best execute the goals of our individual projects, which really are shared goals together. So this is an outline, beginning with tomorrow. We're actually going to meet with them in person. We're going to talk a little bit about our communication charter and what we've called a roadmap of collaboration. And so you can see here that every month we have a plan to talk about things that we've been learning. In terms, things that we've been learning for us will be from our interviews, from then our surveys, from then our focus groups, and then sharing even our reports and drafts of our community needs assessment and our strategic investment plan. They will be sharing some of the secondary research that they're doing, some of the surveys they've already conducted, and also when they begin to complete their draft of the community needs assessment, they'll be reviewing that too. Sharing information of what we're learning of the community, I think, is going to help us build on having very in-depth knowledge of what the needs are, what the gaps may be, and most importantly, help you be able to make informed decisions on how you can strategically invest in services that are needed for children and youth in Richmond. So here's a timeline here for that, and I think we can move on to the next slide. So speaking on why West Ed and why Public Works is here, trying to understand the needs of the community, is because we want to be able to support you in the city of Richmond and RFCY, be strategic in the way that they are investing in the community, particularly with children, who then develop into hopefully young, healthy adults and can then be healthy, productive community members. So we have four main things that we have that we think like the strategic investment plan is going to support. Part of the strategic investment plan will be developing metrics and benchmarks that will help grantees figure out what the impact of their services are and whether more funding needs to be streamlined into their services, and maybe services that they're not providing that they would like to provide, and that that funding can help facilitate in developing more services. So, sorry, I'm having a really hard time right now. I'm not really sure why, but that's okay. So being able to be thoughtful of using these metrics to invest in these services, the strategic investment plan will help you do that. The other thing that the strategic investment plan will do is help you invest in services that are really supporting the entire child, being just looking at the child through a whole child-centered lens, which means really supporting every single area of their development: physical, social, emotional, mental. So when you fund those services, you're really funding the whole child. The other thing that the strategic investment plan will help is in investing in services that are going to help guide families and focus on preventative services. So case management, family support, counseling, youth prevention, not youth prevention, violence prevention. All these different things help create a safe environment and a safe community where kids can also grow up and be healthy. So that's another way that the strategic investment plan will support, the goals of the board. And lastly, it's going to be able to help you invest in services that are equitable and with organizations that are providing trauma-informed and culturally competent services. Okay, next slide. All right. Any questions?
You might have already answered this one, but so you're actually able to look at the CNA prior to this one, and so that you can make the proper provisions to make sure that the one that we're conducting now will be better than the last one, or make provisions to make the one that we're doing now better, or how does that work?
Yeah, so we're going to, Patrick and his team have provided the prior community needs assessment report. We've seen the prior strategic investment plan. We are reviewing all those documents as part of secondary data, and we're also building from their findings to inform the questions that we're asking right now for our key stakeholder interviews and also for our focus groups. But we're also doing additional secondary analysis where we're looking at just current context. That community needs assessment was done in 2020. And so we're looking at census data from now and other different sources of data so that we can stay informed on what may be happening at this time. That's also influencing our questions and the information that we're trying to gather. And so every phase of our project, from the interviews to then the focus groups, every piece that we find where there's maybe gaps that are new, that's going to be informing the next pieces of our stakeholder engagement. Does that answer your question?
It does. And just I know it can be a huge transition. How big of a difference do you think it'll be, since now that we're kind of coming out of COVID and things of that such? Do you think that it'll be a drastic change with the CNA this time around?
I think that's a good question. I think, to be honest, that's what we're looking at right now. We just started doing virtual interviews last week. And I think at this time, we're still really identifying and just listening to the different organizations and still trying to hear what populations they're serving. So I think right now we're formulating that. I don't know if I can really say what we're finding at this time. I'm not sure if.
Excuse me. Let me also follow up on your prior question. I think we have a directive from Patrick to more or less boldly go where no one has gone before, to borrow from Star Trek. Our instructions are very much to not just give you the 2020 CNA Volume 2, but to both update it, because obviously, several years later, things have changed and the program has been implemented for several years, but also to think about what did you not learn from the prior CNA? Where can we forge new ground to look at additional questions about what needs might be in the community and what can be done creatively to meet those needs. So it's intended very much to not just be a rehash or an update of the prior plan, but to think about whatever things have not been answered before and to answer those questions. So I think you'll be getting new information and new thoughts from this, and that's certainly what I think the city wants of us and what we're interested in doing. And in some ways that relates to your second question. A lot has changed in the last couple of years. There's been a sea change in many areas in this country, and I'm sure in Richmond as well. There's a much deeper appreciation and attention to issues of diversity and equity nationwide that that may not be as true in Richmond, which is a place that's very conscious of those issues, but the rest of the world has woken up and started paying more attention to that. COVID-19 has had a dramatic effect in ways that I don't know that we'll entirely understand for another 10 or 20 years, but it's clearly had a dramatic effect on children and youth across the country. We did a project about 2 years ago as the pandemic was ending, that involved a community college in Kansas City, Missouri, and I spent a day as part of that talking with a lot of the students at the various campuses of the community college, and part of this is an effect of how isolating the pandemic was on all of us. I had read things, but I don't think I was anywhere near as aware of the deep impact that the pandemic had on these college-age students. It was a community college, so we were basically talking to people who were high school seniors when the pandemic started, or were just starting their first year of higher education, and the effect to which this affected not just their educations, but their comfort level in being around other people, their socialization at an age where your social development is tremendously important. The things that they missed out on because of the 2 or 3 years of the pandemic are just stunning. And all of the studies and evidence that are coming out since then of the effect that the pandemic years have had on children's educations, on their behavior, on their sense of belonging. We were just talking earlier today with one of the community groups here in Richmond about the widespread epidemic of loneliness in this country, which is affecting adults as well, but as a profound effect on children and youth. And the anger levels that one sees in virtually every aspect of American life today, not all of which, but a lot of which is traceable to the pandemic years. So, I think one of the great things that we're going to need to be looking at, and then anybody who does any sort of study like this in coming years is going to have to be looking at, is what's changed between 2020 and 2024. A lot of it's kind of clear, and what are those effects? Those are things we need to understand and we need to address.
Thank you.
Sure, thank you.
I'm wondering, are you going to have some in-person meetings where you gather input from the community? And if so, where do you plan to do that?
We have a whole bunch of them. Christy, I don't know if you want to go into more detail on this, but we've got some focus groups that we'll be doing, which of course aren't the whole community, but they're subsets of the community. But this will culminate in this visioning event that I mentioned, and it's on the, I'm not sure if you have, or you don't have hard copies of the PowerPoint, but we can make sure you have that. In early April, there's basically a widespread community meeting where we're going to be using a graphic illustrator and things like that help facilitate the conversation. So yes, we're looking for all forms of input that we can get.
So I noticed the organizations that you guys said are like a snapshot of the key stakeholders. Majority of these don't really service Richmond only families. There's quite a few that bring in students or children from other cities, right? So how will you focus on honing in on making sure their Richmond youth have an equitable voice in what their services needs are? Because just majority of the ones that you guys just named really don't service all of our Richmond youth. So I'm just wondering how, or spaces that you will go into that can get the voice of our youth from Richmond.
So if I could, Eric, so right now, the organizations that are listed, and I'd be interested in the ones that you feel fall outside of that realm, but the majority of the organizations that we listed as key stakeholders primarily serve Richmond, not only serve Richmond, but are based in Richmond. The majority of the ones that I think that you saw. Additionally, as we move into key stakeholder interviews, everyone that will be invited has to be a Richmond resident. So that will be the major charge or push. So when we go to solicit for key stakeholder focus groups, we will be requiring that. When surveys go out, that will absolutely be a question. are you a Richmond resident, right, on those surveys, so that we might have those who are adjacent to us, San Pablo, El Cerrito, right? Because there are some organizations that do serve that community. But there are also residents of San Pablo and Richmond who also activate or are actively getting services in Richmond as well. And so in the needs assessment, I think we're going to articulate like the contiguous nature of the work and the service providers' work here in Richmond. But to get at your point, we will ensure that as it relates to some the primary data collection, particularly in our surveys and particularly in our focus groups, they'll only be Richmond residents. And for the surveys, that will be a question that we will make sure that we ask, right? Do you live in Richmond? And where do you live? And if they don't live in Richmond, we might be asking supplemental questions. Okay, which services in Richmond do you access, right? Because we recognize that our neighbors do extend a little bit beyond outside of our borders, but we're thoughtful of it. I'm aware of the question and the importance of making sure that we capture purely Richmond voices as it relates to funding, because these services and the dollars that are set aside to support through the Richmond Fund are only targeted at Richmond residents.
So then to piggyback on that, just because I know like right now the state also funding community schools, and the bulk of the community schools for this district are Richmond schools that will also be conducting community needs assessment based on their needs. Is there any way to like connect with the district to provide so that we're not duplicating parent feedback and duplicating all these surveys right from students and youth to like pinpoint where they're hosting those, so that way there's also like a similar feedback being received?
No, I think that's an excellent point. As has already been highlighted from the Public Works team, we are definitely in conversation not only with Wested, who's doing our evaluation, but we are planning to coordinate and reach out to the school district as well to schedule meetings and get their input. And one of the questions that comes up in these initial conversations is two very important questions as it relates, I think, to what you're trying to get at. One is, who else should we be talking to, right? So asking these key stakeholders. We're addressing, right? Patrick is finite and limited, and also might have bias, right? And so who is it that maybe you don't see that we need to talk to based on your expertise and experience? And also, one of the questions that we point to is there data that you have or are aware of that you could share with us, right? Is there data sets, data points, or is there data that we should be considering gathering as it relates to moving this project forward? And so that'll be a question that we do bring up as we go into some of these meetings.
And then, sorry, will this also be advertised in multiple language based on the needs of Richmond?
Absolutely. So I've just brought this up today that a lot of these things, one of the things we did last time, which I really appreciated and I brought up going forward, is that I want to make sure that we do have some monolingual focus groups that are purely in Spanish, and we did it last year, I think, with some of our parents and also some of our young people who might have been first generation or immigrant community members. And so that is definitely something that we are thinking about, and making sure that any marketing material is accessible from all of our residents, not just around language accessibility, but also in relationship to disability, right? And so making sure that when we do things on social media, that there are closed captions, right? And so we're trying to make sure that we are as inclusive as possible and representative of the full diversity of what the experience of being a Richmond resident is, no matter where you sit, stand, live, work, play.
Any more questions?
So we're not done with you yet.
But there's more.
Yes. So we wanted to take this opportunity because you all, we believe, are key stakeholders as well, key interest holders in this work. And so we wanted to take the opportunity to ask you some questions about your experiences, things that maybe you'd like to see. And so Jeanette and the Public Works team is going to ask you some questions, and I think she's going to give you all some Post-its to maybe stimulate some conversation. Jeanette, I hope I'm not stepping on your toes here. Just framing here a little bit. Get some input around maybe some really important questions, because we don't want to say that we talked to everybody, but we didn't talk to you. And so you all have not only lived experiences, but we believe a series and a level of expertise that we don't want to miss in this process. And so, yes, we will be delivering a product that says, here's what everybody else said, but we also want to make sure that your perspectives, your views, your experiences are captured through this process.
Yeah, thank you very much. So, we're going to be asking 4 questions tonight, and these questions are based on the questions we're actually asking our key stakeholders right now. And the main questions are going through a number of topics. So the first thing that we really want to understand is, based on your experience and based on the work that you're doing, your knowledge of the community, what are the needs that you think children and youth have in Richmond? Then, as we have our conversations with key stakeholders, and as we're going to have conversations with you right now and get your input, we want to talk about what you think might be challenges that organizations are maybe facing as they try to serve the children and youth of Richmond. And then we want to get your input really building on the question that you were asking of, what are you hoping to learn from the community needs assessment? What would make a good community needs assessment? What questions and answers do you want us to be able to answer in that report? Because if it's not helping organizations that are serving children and youth know what services the children and youth need and what they can improve on, what they need to develop more, then it's not going to be a helpful report. And we want it to be helpful, specifically with the people who are on the ground serving kids and youth every day. So that's why we have these questions, and that's why we're going to go through them with you, because you have valuable feedback as well. So I'm going to give you Post-its. You're going to get a pencil. And I'm going to give you about a couple of minutes so you can just think about the first question. What are the pressing needs of children and youth in Richmond? So I know that I gave you one Post-it, but please don't think that that's just because you can only talk about one need. If you need more than one Post-it, just share your thoughts. Happy to give you more. time, that's all right. I'm just gonna go ahead and start. I do apologize that you can't really see your own post-its right now with your writing, but I'm gonna just read some of them out loud and then just ask that whoever wrote it, or if anyone wants to expand on whatever was already said, that you do that, okay? So one of the things that's standing out here that I can say based on already some of the interviews that we've had with organizations, yeah, I can get that one, is a concern for mental health and for safety of children and youth, particularly with their frequent exposure to violence, and also how desensitized sometimes youth are getting to it as well, in their response. So right now I see here a post-it that says, I think safety and mental health services are pressing for kids in Richmond. That's something that we're identifying as well. Does anyone want to expand a little bit on that? What you mean by mental health services, if there's a specific type of like service that you think?
I would say, well, my experience with working with a lot of the youth, and that can stem from anywhere from just emotional support, even if it's at home that they're not getting, or whether it's school things that are going on. So when we say mental health, it's broad, right? You know, you can say, well, they need help with mental health, but what does that look like? And I think that children to have a safe place to express what that looks like, because it's so general, is a major issue. Sometimes they can say that they are having mental health issues, but who can they express that with, and how can they do that? So I would say maybe an agency or a place where they can actually express those things without bias or without being subjected to saying that there's, you know, a huge risk here or something like that. Just, I think that's, if I just want to expand on that a little bit.
Yeah, no, I appreciate that. I think what I heard you say is, okay, when we talk about mental health support, every, children and youth have there's needs that they have, and do they have an outlet, or do they have a support or a person or a relationship where they build enough trust where they can maybe seek that emotional support, whatever that may look like. So we've been hearing that a lot. Do you have a person? Do you know how to develop relationships where you have that depth and intimacy to maybe be vulnerable and express whatever's on your mind and whatever you're feeling? And that's just one way that we can think about mental health. There's so many, but I think that's what I was hearing you say. Is that correct? Yeah. Anything else that you want?
I think to piggyback on that, and that just from my perspective, being that a lot of families right now, due to being able to pay their rent and food necessities, right, they no longer qualify for Medi-Cal. So if there's BH services, it's higher income limits, because not everyone can afford that BH services if they have to pay out of pocket. So how accessible is that to our youth?
I'm going to write that down too. Does anyone else want to add to that?
And also how to like destigmatize, right, for like Latino males or even females, Latinos in general. I don't know about other races, but it's that loca, right? You don't talk about that, so that taboo. So how do you, if this does, how do you tailor it to where, I don't know, when you think of mental health or behavioral health in Spanish, it's not, you don't go. You think manicomio or something, so I don't know how to.
Culturally competent services. Right. It's how people can access those culturally competent services.
Yeah.
I didn't mean to put words in your mouth. I think
No, I know, it's like, I don't know how to
I think
express
that's
it.
I think that's what you were talking about. That's what we're hearing.
Yeah. Manicomio, for anyone who doesn't, it's like, it's a psychiatric word, right? So I think what I'm hearing you say is if you express sometimes how you're feeling, and if it feels very vulnerable, or if it feels like something that maybe culturally you've been taught to maybe refrain or not say, but then you do say it, you go into this taboo area where then you can be labeled as a, very extreme, like, oh, well, if you're feeling that way, then you must be crazy, you must be really depressed, or you must be this or that. And there's just like these extreme ways of
Yeah, I'm just wondering, like,
labeling someone.
so like when we do, if in fact, right, because there's a difference of like surveying families, the adults, right? And then there's a difference in surveying youth, surveying youth. So when we do survey the youth, like how will we languagely accessibly advertise this when at home they're being said something else? So I'm just thinking when we're conducting the assessment, like how will you adapt that language for that youth to feel comfortable and say, I get what you mean, not where it's like the parent telling them you're crazy.
I'm going to write that as culturally competent assessment tools, along with also just like cultural competence. really thoughtful. So I have one here that says pressing needs, mental health, behavioral support, financial assistance, um, children just needing more love and support, um, affirmations, and support in school, better educational resources in schools. Anyone want to expand on what they mean by maybe educational resources in school, or based on your experience, if you want to elaborate a little bit more on that? Go for it. We were just talking about it. Go for it.
So when I think of that specifically, just because I was able to do a site visit in Anaheim with our district, so it's how do we encompass to provide services within schools, because not everyone is fortunate enough to stay after school, right? So it's also thinking outside the box on how do we provide services within school, maybe providing restrictions on our funds specifically, because our district isn't so great in that sense, but maybe looking at how City of San Pablo funds or has like certain criterias that in the future we can look into City of San Pablo, City of Richmond. And then for like our older youth, like workforce development, I know we have our agency, but it's not, how is that message getting to our youth to do like the summer internships and everything? I think we see it advertised publicly, but what's really going on within our schools to say, hey, this is what it is, especially if youth don't know what it is, and then their families don't know, especially because the timeline, I guess right now I see quite a few right now with Richmond Youth Works, like apply now deadline, but are our youth really thinking that far ahead? Or how is that presented? So I'm just wondering, like with our youth that don't know how to navigate to get an ID, to even apply, to create a resume, but there's an agency here in the city, but how is that being trickled down within the schools? Like being that that's the hub, how do we get to them?
Thank you for elaborating more on that. Yeah, Carol.
I just want to piggyback on that a little bit in that I think that there's certain youth that we just don't reach. They fall through the cracks. That's what I think is the pressing issue, is that we somehow are able to identify those children that aren't getting services that should be. Like, how do you reach their parents, or how do you let them know that there's services available?
Yeah. Yeah.
Sorry. And also how to create like career pathways. So like if partnering with like, I don't know if we have an ROP in our city, in our district, or in the county, but figuring out how they can provide like CTE classes within our youth, that's also another thing, especially with teacher shortage now.
Yeah, yeah. Want to move on to the second question that we have, because I know we're running out of time, but I just want to highlight to you that when we talk about more support and education, and both Stephanie and Carol, you've talked about the need to communicate effectively using our communication channels at school for kids to know what community resources that are available and how to access them. That other people have also mentioned just in general academic support, an emphasis on access to literature, digital accessibility, it's huge. We've already been learning a little bit about that. Technology resources, one that hasn't been talked about right now, food security. Yeah, and then we have here same emphasis, I think, on academic support, making sure we're reaching hard to reach youth, children and youth that somehow are still falling through the cracks, that we need to be able to figure out how we can identify and support early. Anything else that you would like to add as I just quickly recap what you all shared? Yeah.
Just one thought on the support for parents in some way to be able to then reach out to kids. So it's in some way that there's support for parents.
Yeah,
And
thank you for that.
And I think another need that we have is not so much the access to services, but the dropping of the ball when it comes to services. So I think we have a lot of services, but I think that every service provider works individually. And how do we service a child
building a system that's integrated so that when one drops the ball, the other one is picking it up, and like really servicing the whole child when it comes to education, when it comes to, food insecurities, when it comes to family and support. That means that, if I don't pick on something, I don't pick something up when he's at school, maybe the after school program where this child is attending might tap into something, and, really making out some type of system where, we are moving together in a sense, so that we are being able to service a whole child. And I think that's the problem when it comes to services. How do we service a whole child within the systems that we already have here? And how do we now build a system around a whole child to be able to service him? So they're not falling between the cracks, because I think that is happening a lot, that we don't have enough manpower, but I think we're working individually instead of, working together to be able to, like I said, catch those balls being dropped unintentionally, so that we're servicing, a whole child, a whole family, a whole community.
Yeah, it's really insightful. Thank you. Yeah, just, that's helpful. Okay. We'll move on to the second section here, and Christy is gonna walk you through this. I'm gonna pass out more Post-its. I'll give you a few more this time, okay?
Kind of piggybacking on our first question, so we've kind of identified, scoped out what are the needs, but we've touched upon this a little bit already, but what are the obstacles? And I think some of it, you've just kind of just said, maybe falling through the cracks, maybe there's, I don't know, the words around, but you give an example, effective case management, integration of services, but if there are any others you would like, that come to mind, because these aren't coming out neatly. These are something.
But we got some already.
Oh, you
Oh,
got,
yes,
you got
yes.
some, oh, sorry. I'm giving you extra. Yeah, let's take a minute, I'd like you to take a minute to kind of think about that. everyone? Yeah, I think I got it. Let's do that first. Okay, let's kind of talk about these. Parents who don't care or hard to reach. Anything you'd like to say about that? That is, it's a, we've heard this multiple times.
Yeah, if the parents are negligent, how is the kid gonna get the services? The parents don't put any effort into it.
So in addition to obviously services for kids, not that maybe additional service to parents, but it's dissemination, maybe it's making sure that they're aware of what's going on, but there's also deeper issues, but first they have to even know what's out there.
And even if they know it's out there, they might not care.
True. The lack of, okay, I'm just gonna read this one from right now. The lack of intentional outreach. Whose was that? Tell me a little bit more about what you mean by intentional. But also let's go through it. You said partnerships, and this is kind of reading the main areas. Diversifying, or you say maybe the lack of diversified programs.
Yeah.
And income eligibility. Let's talk a little bit about intentional outreach.
So I think predominantly, you see everything being promoted digitally nowadays, but not everyone has the accessibility to have internet at home or their phone and be a smartphone, or if they do, they don't really know how to navigate it, right? We assume because they have Facebook, they know how to navigate, but in reality, they might just know how to call their family members. So it's the intention of where do you put the flyers, right? Are you partnering with different organizations? We know patients, our youth go to clinics, so using the community clinics or even the county clinic as a resource to connect.
When you talk about the media, it's called the digital divide.
Yep.
Because we learned this in the pandemic. A lot of kids in various communities were sent home with laptops, but some children were doing homework in cars.
Yep.
Because there was no internet connectivity. That is a big issue that affects a lot of children of color. So I completely understand. Now, in partnerships, what types of partnerships do you see as obstacles? Would you like to see additional?
There's a lack of partnerships. Everybody's working in a silo, so you're targeting your direct audience in your own way, but you're not partnering with CBOs and the clinics and other organizations that are providing, or faith-based organizations as well. And then cost of living is just income eligibility. That whole medical eligible or low income doesn't work if you're really gonna have to pay rent, when I think most people are paying about close to $3,000 for an apartment, 2-bedroom basic for family, right? And if you're doing low income, that doesn't work nowadays. So rethinking what cost of living is for Richmond in itself.
Thank you.
Stephanie, sorry, just have a follow-up question. When you talk about silos, are there any specific, like maybe type of service in general, like large bucket service, where you're noticing that it's more siloed in the city of Richmond than others?
It's like, unless you're like following all these groups, you know what's going on. But if not, like if we have the library who really goes to the library, they have tutoring hours, but we're looking at our families that are working 2 to 3 jobs to, provide for their children, even though they might get the information that's who can take their children. How do you get from point A to point B? If school of residence, you walk to your school, but you can't do anything outside of that. So it's not necessarily that they might, but it's like intentionally service this school, this group of students. But how do you promote to get to like we have a pool, right, to swim indoor, but where is that located at? So who are you intentionally targeting? I don't know, like RPAL, like do we have a busing program that can pick up our students to go to RPAL? Do we have the library? We have one library, who can get to that library? So it's just like thinking outside the box, what lines are crossed, where does the bus pass? Do our families feel comfortable enough for our youth to take the bus? Yes, we have Richmond Moves, but how is that also being promoted outside of like those that have an app and everything else? So, yeah.
Yeah, thank you. That's helpful.
Okay. Politics in the community. Financial barriers, which some of this we were just touching upon, but I'd like you to tell me a little bit what you mean by financial barriers. Biased attitudes of certain educational stakeholders, am I reading this correctly? And I think something on integration of services, I'm sorry.
I'm sorry.
That's okay.
Barriers.
Barriers, yeah. Okay, but politics, talk to me.
Well, we were having a really good discussion in the break room earlier, and this is just from my personal experience. I was just sharing with Stephanie how I experienced firsthand a situation where I have a nephew who was waiting at the same time as another Hispanic kid who he knows on our block, and same time applying
Waiting for,
to get into a school, to a
Okay.
charter school.
okay.
Same time applying. Family lives literally 3 houses down, and there was just a lot of biasness that my family experienced firsthand, and I brought that to Stephanie's attention, and I talked to somebody else, but to make it
You think
plain.
racial, fine.
I mean, and whether it's racial, but also it's not just a racial, I can say, it's also within the educational system, if that makes any sense as well, and I've experienced it firsthand.
Do you think putting aside racial issues, things like, we're working in a school district right now where this is coming up all the time. This is kind of like who you know, and then something.
Absolutely. So if it's I mean, I get it. I mean, it happens in the work field too. There's nepotism. If I know you, then I'm gonna wink, and we'll get it done. But it's unfair, especially with kids, when it comes to our children. And it's going on more so than not. I actually work at the Richmond Police Activities League, and it's not just with my personal experience, it's with my kids saying, well, so-and-so got this service, how come I didn't offer it? And we were at the same time at the same place when this same altercation happened. So I'm seeing a social injustice more towards what these youth are experiencing, if that makes any sense.
Because actually, that goes to one of the questions that we're asking stakeholders. What are the disparities sometimes, the root causes that kind of give rise to some of the obstacles? That's what we're kind of asking you. You're saying, more like how was that situation with your nephew? Was it ever resolved? Did he get into?
He got in. He did, but we waited for like another maybe 4 weeks before they kept saying, we'll get back to you. We don't know what's going on with the application. And Roberto, who's our neighbor, he's really good. We have a really good relationship with him, and he was just like, we'll go down there. Let's all talk together. And I'm just like, we appreciate it, but we're just gonna actually sit back and see how this plays out. And he waited. Very unfair, when my nephew was like, well, when am I gonna start the new school? But and Roberto said he didn't know anybody in the school. He didn't have any favors or anything. It is a predominantly Hispanic and Latino charter school for the most part, but we wanted to know like what was taking so long for him to be enrolled and to get the okay to go to school, and his kids were in way before. And there was no valid reason why he had to wait. It was just a matter of, we still have a lot of applications that we're going through. We are backlogged, right? So, okay.
What financial barriers come to mind for you?
Financial barriers, I would say, some of the youth, kind of what Stephanie had mentioned, some of them may not have a ride to get to some of the services that they're trying to get to. So there's financial barriers. I know some of my kiddos in the program that I help organize will say, hey, T, I didn't have this or that to catch an Uber, or some of them just don't have the financial means. But also what I am learning is, and it's just to my experience working with a lot of the youth, a McDonald's hamburger or a soda just doesn't cut it. These kids are actually asking for, well, if I'm getting what additional services can I actually receive? So a lot of the times we're seeing that if a kid is in need of something, then we're going to say, well, we're all for a stipend. How would you feel about that? And then they'll be more adamant about wanting to receive those services or continuing those services versus just, I have to show up.
So they would like an incentive. They need
Incentives. Absolutely.
And that's something that we've thought about with our surveys as well as an incentive so we can increase our response rate. So we can actually, you have to meet people where they are.
Right.
You have to get them,
Right.
How can we get them to actually participate? And that's stuff we've done in other projects as well.
No, they don't want a cheeseburger. They want some.
Hamburgers, I
No, it's not working no more.
Okay. Systems that fall short when servicing children and families. Okay, communication of services, outreach, affairs with other stakeholders, information sharing. So the system, what types of systems?
I'm thinking systems across the board. So I think, when it comes to cities and, work in our educational system, we're in West Contra Costa. West Contra Costa is really big. It covers a lot of cities, and you see some cities that are working, hand in hand, supporting their schools in their city, and some cities that are falling short because they're not participating in that, support part. And Richmond is one of the bigger cities, I think, that fall short when it comes to our children's education. So, really focusing in on how do we form partnerships that is gonna contribute to the success of services, education, well-being, it kind of all, the whole child. So I think, those systems are falling short. And then I think when it comes to, data sharing, that's a big thing within organizations. We all say we want to work together, but at the, same time, we want to continue to support our organization. We want to keep our families, here. We want to serve our families. And I think it's really hard to sometimes be able to come together and work together within organizations, in the city.
No, thank you for that. Data is a big, big issue. That's another one of our topics that we talk about with stakeholders. Asking them what types of data sets, like we're talking about, what types of data should we be looking at? Can you suggest it? And that transcends, just in terms of also my background, data sharing transcends education. Also, a big issue in healthcare. Because if you're going from one provider to another, and those systems interoperability, they don't talk to each other. It's like you're starting from scratch. That can make people not even want to go to the doctor. Well, you don't know what I'm taking from this. But also education. Say kids switch schools, starting from the ground up. But that whole partnership component, sharing information is so key. But no, thank you for that. All this is great. So I see all caps here. Social media. So I'm like, maybe we should go from the bottom up. Tell me a little bit more about this. You said become more community. Maybe is it distant? Yeah, distant. What do you? Let's talk about that a little bit. No, I know. This is. Please tell us your thoughts. Don't hesitate.
Well, personally, yeah, maybe that work. No, personally, I've talked to my sister about this multiple times. I feel like they should shut down social media, meaning YouTube, including everything, for a whole month at least, and just see how the world be. I feel like the whole world probably will burn, but it's okay. But because you can post something good, and then people will be like, oh, since they're having something good and I'm not, I'm still like, oh, that's bad, and then so now that your good post has now turned into a bad post. Just for another example, people with disabilities, just across the board, they can use it as a good thing, but then they'll get oh, you're using your child with a disability, or you're using your own disability for clout, and it's like, oh, I was just trying to spread awareness, and it's no. Or they go with the, why do you look like that, and then it's always the, okay, the good, why do you look like that, or it's oh, why do you look like that, you look crazy, and it's what? So yeah.
Nothing is viewed as it should be anymore. You could say I'm having a great day today. There will be someone who will say, no, it's not. Why you? Who are you to say it's a good day? But I see what you're saying. It's all of the negative effects of social media. It can be great, but there's lots. There was hearing on Capitol Hill. Mark Zuckerberg turned around and he apologized to all of the parents. Well, not all, the parents that had kids that had killed themselves due to bullying. And there was one parent, he stood there, he's like, I won't take your apology. It's like, this is what happened to my child. That's sad. I think if we shut it down, I think there would be riots and burning in the street. But no, literally, it's changing the wiring of kids' brains. this is going into neurological effects. But no, I see completely what you're saying. You can't just say anything. You have to really monitor yourself with what you're saying, especially for young children. I mean, body image issues for girls. It's all of this. It can be very toxic. So thank you for that. Okay, that's the last one here. Lack of backup to fall back on. If someone misses a step, is there enough support, financial, emotional, mental, to push them in the right direction? Anything else? Anything you would like to expound upon?
I mean, just as I'm, hearing different thoughts and points in terms of like the it takes sometimes like a multiple times effort to like to get in the right kind of a system in the right direction, and like do we have enough support for kids and families and parents to say, okay, it's not just like a one chance, but it's like a whole system supporting them, for them to be able to do that. It's like, so it's maybe just like a very big question, but I don't know. Who knows?
No, I see exactly what you're saying. You're looking at it at the macro level, the entire system.
Yeah.
Are there enough supports in place? And we're really kind of in all of these areas, financial, emotional, but
Because when we think of the obstacles, right? Because it's not, it's like when somebody is following directions, it's like, okay, it's fine, and as soon as somebody's like, for whatever reason, misses a step, it's like,
falls through the cracks. Then
yeah,
how do we get this
exactly
back on the right
point
track?
that Guadalupe made.
Exactly.
Yeah.
No, this is, again, this is all great. It's validating what we're hearing, and we're still in that preliminary stage, but also gives us thoughts as to where we want to take things, even we want to, edit or not say change, think about how we want to interact with stakeholders in the future, just kind of given your vantage point, given your perch that you all sit on. These are great answers to responses to these questions.
And I think one of the biggest things for me, that we didn't touch on was, building the relationship of trust. I think that's really important, and I think we've dropped the ball on that, as I think one of the biggest obstacles within the city, because the city has many layers to it, and the people that make up the city is, many layers and different. And I think, how do we now come back and build trust to then be able to implement and enforce and move forward cohesively? So I think, that's a big one for me.
Okay, so we're actually going to combine questions 3 and 4 here because, for one thing, they're basically both the riposte to the question that you asked, Co-Chair Galloway. How is this CNA going to be different from the last one? What are we getting from this? We want to ask you, what is it you want to be getting from us? We want your guidance on this. The question 3 is, what would a successful and insightful community needs assessment look like to you? And question 4, somewhat similarly, is what questions would you like the needs assessment to answer? So that's what we want to be asking. What do you want to see from this? What is the success going to look like? What are the questions that you want to see us answering? What do you want in this CNA? And again, just to okay, the amount of ones up there already.
I think so.
I'm going to give a couple more because actually what I'd like to do is ask you if you have multiple comments or questions you want to make, put them onto separate things because I want to kind of arrange them around and group them accordingly. So I'll give you extra ones here. So make as many comments as you want, but if you could put each on a different one of these things, that'd be great. Joe, keep looking up at this question and put this back to see the other question too, if that helps.
Is there tape? There, some of these wrote upside down.
On the backside?
Did that work anyway? Here we go. The returns are coming in. This goes with this?
No, because you said two questions.
Yeah.
So it's, well,
Oh, you got two questions on that one?
okay, this is what it looks like. That one is what the second, or the other question.
Oh, okay. So I think we've got a really great input from you on the first two questions that were substantive. I mean, it's the kind of discussion we really look forward to having. It was great input. And this one, you had me worried because these two questions really go to what is it you expect from us and what work do you want us doing. You guys took a really long time on that. So, but I think that they kind of sort out into, I've broken them into 4 general categories that we can talk about that I think are cross-cutting concerns that you all seem to have. I should have put my glasses down. I need to go back and read these. What we have here is kind of, roughly I've broken this out as what do you want out of this process? What do you want to see as an end result? We've got a couple of processy things here that you want to get into. One was transparency, what's working and not working in terms of information flow, communication, open dialogue and inclusion of those who lack what they need to provide services. So that this whole, with the process and the ultimate report itself should be transparent, it should be inclusive, it should involve a lot of communication and so forth. Now, what is that communication going to consist of, and what's it going to concern? I think the area that got the most input from all of you was really, or the most questions from all of you that you want to see, go to aspects of the population that are being surveyed, essentially making sure that everybody's getting included in one way or another. So the percentage of respondents are proportional to, not sure what ATY is, but it's parentheses, or city. What percentage of respondents proportional to city youth population. So in other words, we want a representative sample for our input into this. Diversified respondents, race, language, abilities, needs, socioeconomic ages, and identities, I think is what it says. A successful CNA reaches all members of the community, heard everyone's voice. What does it look like? A real bare informational data map, services mapping in areas served by neighborhood, and a related but slightly different question or issue is how often can we expect updates about participation? And then versus now, I'm assuming is a reference, I think this was yours, the difference between the 2020 and 2024 report, then versus now?
Correct. The participation in the first CNA versus the participation in the one that's being conducted now.
Okay, right. So we'll definitely be addressing that. Then some particular issues in terms of, oh no, I'm sorry. This one is the kind of overarching issue that I think everybody seems to be interested in. So what services do you need? What services are successful in your school, neighborhood, or city, the city that you go to, and why? Where are youth not getting the services they need, and how do we address that problem? Answers on where we are falling short and where we are moving in a sustained area of services. So there's kind of a category of what's working, what's not, what do we need. So, oh, there's another one. Keep us busy all year, I can see. Asset mapping, current services being provided, location, and receiving funds. So we've got a series of questions here really dealing with the set of services that are available and that are lacking and that are needed and so forth in the city. And then there's this category that kind of breaks down from that specific interests in some subsets of services, such as future services, cradle to career, not only thinking about higher ed, but trade schools, what's offered to youth. Talk about not just building the person, but building a flourishing community. What does synergy look like in a community? So we have some community concerns, whole person concerns, some particular aspects of education that go beyond just the immediate school system, but looking long-term at what different people's needs are in terms of investment. I think you could probably break these down other ways, but I broke this down to 4 main categories here that I think synthesize what you all are talking about. The process issues about communication and transparency within the process of doing the report and the report itself. making sure that there's adequate representation of the diverse population we see here in Richmond. The big issue, obviously, is what are the service gaps and needs, and what exists and what doesn't. And then finally, some specifics on some particular areas of services, particularly looking at the future, looking at the whole person, looking at the whole community. So looking broadly at how we can be answering this question here of what are the needs and what's needed. So kind of broke the things down like that, and with that as something of a framework, I just want to turn it back to all of you to elaborate or ask questions about what we're seeing here in terms of what you want from the needs assessment. So, any further direction that you want to give to us of what this should turn out to be, any other questions you have or input that you can give us, that'd be great. Thoughts on what you're seeing here, what you can tell us?
I think that we had a really good conversation, and a lot of questions were answered, and I'm pretty sure we'll have more questions as we go along through the process. But I think that it's good to know that, all of us are going in the same direction as far as what we want to see and your expectation of us and our expectation as we go through the process. But I think that the conversation today was really good.
I'm glad to hear that. It certainly was for us. I think we got a lot from that from all of you. And of course, we're going to be back 2 more times to go over this stuff with you. So we're not letting you off any easier than you're letting us off.
Could we just get an update of like when those focus groups are happening, just in case we pop in on one of them, but at least to know when like those are on the calendars?
Absolutely. So we will definitely be sending that information out to you. We'll also be sharing that information with community and also council members. We'll be also soliciting support from our nonprofits who can help us provide the individuals that we really are trying to target. And with focus groups, I think what they leverage is the opportunity, has been shared tonight, is to kind of prevent that kind of falling through the cracks piece. So by using different modalities as far as data collection, primary data collection in this process, hopefully we end up with as 360 a view in the service provisions and also maybe service needs gaps, and as you were interested in assets. And so we'll definitely be sharing that with you all.
Any more questions or comments? Oh, well, thank you so much for this presentation. Thank you.
I just want to thank Public Works for being nimble tonight. I appreciate it. I'm really grateful, and I really enjoyed hearing you all participate in this conversation. I know it extended further than we might typically, but I felt like it was worthwhile to kind of spend some of this time engaging with Public Works and also getting a feel for how they're going to be engaging with residents. And so you can say that we had an opportunity to do the very same thing that you're being asked to do, and getting that opportunity.
And if I could quickly also just add that if you think about anything, if you're like, oh, I have a better answer, or I want to add something to that answer I gave in the middle of the night, send Patrick an email. You can also call him directly.
I'm going to give you guys my cell phone.
There we go. And I sincerely mean, please do contact him.
Yes. I'm serious too. I'm going to give you my cell phone number. Write it down.
There you go.
510.
And we'll email you all.
This is a city
It's a city
phone.
phone. It's a city phone. It's okay. It's telling the world right now.
So my work cell is 510-806-5861.
Say that one more time slower, please.
Sure. 510-806-5861.
So anything you think about that you want us to know so we can tell Public Works.
Yep.
So we can tell West
You can call
Ed.
me, text me.
please share. If you have ideas about other groups we missed and should have talked to that you think, like, let us know. So we really do appreciate your input and feedback, and thank you to our FCY staff. I mean, before we go to the next item, I don't believe so, but are there any public speakers on this item?
There are no public speakers.
Seeing and hearing none.
There
Thank
you go.
you.
All right, and if we don't have anything else on the agenda, we're going to call this meeting to adjourn.
Oh, we do.
Oh, we do?
We do.
Where?
One more item. We don't have, no.
Oh, wait, sorry, it's F2 right on my screen. Just kidding. Agenda item F2.
Yes, agenda item F2 is to receive a presentation on updates to the Richmond Department of Children and Youth recruitment plan.
All right. Hopefully we won't keep you too late for that because you guys have all been very diligent and we love, I think you love to tell us more about you than you probably want to hear us talk at you. So I'll try to keep it short. Guadalupe Morales, Department of Children and Youth. Just wanted to quickly give a super high level overview of what our outline for recruitment plan is. I think we've definitely been mentioning it the last few hours. So hopefully we can give you all a better idea and a better accountability for us to move forward with that. So with the Oversight Board, back in December 2019, we had a fully seated Oversight Board of 15 members. Currently, right now, we do have 7 out of 15, but you all do such a fabulous job. You basically are 15. But we do want to make sure, as many of you have kindly reminded us, we do need more folks. So right now, our target is that we want to fill 8 seats by the end of 2024. Hopefully, right now, it's February, so we hope that with these plans that we have in action, these goals, these strategies, we should ideally be able to fill 8, but if not, as much as we can to make sure that there's a lot more voices and a lot more bodies on the board. And that's, I'm sure we all want to see that, more diversity and more representation. So with that, with the next slide. All right, and so with you all, with the Oversight Board, we do want to make sure that however long you are with us, that we provide you a beneficial experience. We want to make sure that you walk away with a new skill set. We want to make sure that we give you all more learning opportunities and also an expanded network, whether that means getting more opportunities with the city staff, with nonprofit organizations, with our consultants who kindly joined us, or any other community members. We want to make sure you walk away with something positive and with a change to your life. And one, I would say small but very significant step we've done to make sure that we do more outreach is that we did a logo. It says redesign, but we just brought a new logo, and we're really, really excited about that. And actually, I guess I'll spoil it a little bit for Abdul, but we brought some stuff for you all, some goodies. So if you stick around long enough, he'll give them to you. And with that, we hope that we can, of course, as we start to go out more in the community, have more increased branding and visibility. So make sure that people see us, they can walk up to us and ask us questions and be more interested in learning about what we do. And hopefully that becomes kind of cool to them and they want to join us. So with that, in addition to making sure that all of our stuff, we have hoodies for you, we have all our merchandise, our canopies and everything. Make sure we also do equal representation on our social media and print documents as well. So that's like flyers, pamphlets, things that we give away a lot. All right, next slide. All right, so this is pretty high level, but we do, like I said, this is not the final recruitment plan we have for you all, but kind of overview what we do hope to work on. And the main priorities is to identify, engage, and recruit potential members. I think we're doing a lot of the work right now with Public Works and even West Ed. We want to make sure that we tap into our various interest holders. I know that's something that Pat has been teaching us to learn how to say, I should say key interest holders. So that means connecting with local CBOs or community-based organizations, being able to tap into local high schools more, and our neighborhood councils. It says mayor, but we mean the mayor and the mayor's office as well, because the staff do great work, and also our city council members as well. And so with that, being able to connect with them, we hope to identify a lot of the key entities and ways that we can connect with youth on their development, on education, and how to, in general, do community engagement. So we hope in the next few months, I know it's been on hold and it's been something we've mentioned the last few months, is that we do hope to reconnect with the service provider working group soon, especially now that we're doing the community needs assessment. That should be in the works. And mentioned before, the CBOs, local high schools, neighborhood councils, and city departments. not only to really get a better understanding of what we need to do, as we mentioned, to further incentivize and be able to bring youth to us, but what ways we can do, or if there might be different ways for us to bring youth here. So I know Board Member Hagstrom mentioned earlier about maybe doing like a referral or nomination process, and that's something we're going to seriously consider to be able to target more youth to come on board, and adults as well. And then lastly, we do want to mention that we're going to be doing more of a concerted effort to do outreach. So that means participating in community events. I know we mentioned them earlier, so that I know we recently did MLK Day, and I think we did another one too. We did a number of other ones. So we do
Elsa Barney Stroll.
Oh yes, that one. Sorry. So we do hope, especially it's a new year, we're pretty familiar with new event or most of the events in Richmond, but we do hope to really be out there and engaging. And now that we would have more materials and more information for folks, we hope to bring that to the community. And also with that, being more involved with city and nonprofit and other types of programs and events. So if you ever hear of anything, feel free to let us know. If there's something that's not on our radar, we would happily go. We have a bigger team, so we can definitely do a lot more. All right, next slide. All right, and then two other things we do want to work on is our social media campaign, and we do want to also start tying in an evaluation and feedback. And I know with Abdul, he's been doing fabulous work with enhancing our social media, but we do want to do more of a directed effort to enhance our online presence, and that it means, or I guess I would involve two things. Having a more dedicated section of the website for youth board member information. We did ask and currently have some bios that we did a few years back, but that needs a refresh. So we hope to update that with better information. And then two, we do want to start developing a recognition program for active youth board members as well. So we want to do profiles on you all. Hopefully we'll be working on that in the next few months. But we do want to be able to recognize all the work that you do and maybe other work that you do in Richmond, and really be able to showcase that to the community. And then with that, internally with staff, we do want to make sure that we want to keep ourselves on track. So we're going to be developing our own key performance indicators, or basically our own metrics, to make sure that we're staying on track with what we want to do. And doing regular assessments of our strategy. So that means both internally we'll be meeting as a team to make sure that we're doing things right, or if things are not working, we can redo. And then also coming back to you all to hopefully let you know what's been going on and what kind of progress we've been making. All right, and so mentioned, I do have a very rough timeline of what we hope to do. It's kind of tiny, but let me know if you can read it. If not, I'm happy to send it. But we do hope in the next few weeks we start doing an interest holder analysis. Sounds fancier than it is. You're good. Basically, we want to start looking into what groups and what organizations we can ask and see where we can recruit more members. That shouldn't take up too much time. We're already doing the work right now with Public Works and with West Ed, so, and especially as a grant program, we should already know these people. So hopefully that shouldn't take too long. And then with that too, we want to further develop the key performance indicators we have below. So that would be another step there. Website development has already kind of started, but we want to dedicate some weeks to really get that launched and ready to go before we start going out in the community. And then lastly, the biggest portion of what we'll be doing is doing a lot of social media and outreach in the next few months, hopefully until the end of the summer, at which point I think it would be a great idea for us to evaluate and see what we can do. I think at that point would be a great turn for back to school events, kind of turn in the year. So that would be a great time for us to really see what we need to do to continue that work, but as the school year commences again. So below I did list a few initial key performance indicators. Again, this might change over the next few months, but some things that we want to target would be attending an event at least once a month, having at least 20 applications submitted for the Oversight Board. We do want to start doing a survey once we go out to communities. So again, kind of an initial number, but we do want to have at least 100 surveys completed so we can get a better idea of what we need to do to further incentivize folks to learn more about us, and then hosting possibly at least 5 RFCY hosted events. This can include things like our service provider working group, community forums, things that we host here at the city. So some just potential ideas that we could do. Next slide. And yeah, that I would say is all, but I guess I do want to maybe end with saying that our next steps is that we do want to start working on some of these initial, I'd say objectives with developing our key performance indicators and our timeline. So we hope to bring that back to you. And also, I know with our ad hoc committee as well, the retreat is something that we do want to bring to you in the next few months as part of that recruitment strategy to make sure that you guys are getting something out of it as well. So we do want to come back with an update on this, hopefully in the next month or two. Yeah, any questions? Or if, I don't know if Abdul wanted to add anything, or you're good? Or if you wanted to bring out the goodies too.
But I guess to wrap it up, it'll just it will take a collaborative effort from us and our board members, and reach out to the community and let them know of the service that RDCY does, because we do a lot of great things for the community, and we just want to make sure that people who have or need access to those resources get those access to those resources.
One question I have, what is the number of board members that were looking for adult and youth board seats available? And what's the turnaround time when it comes to application processing?
Yeah, that's a great question. Let me see. I think I may have it listed. I think we have about, is it 2 youth board members seated, right? And then right now it's 5 adult members. So we have, and then it doesn't have to be specifically 8 or specifically 7 youth or adult. I think we always left, I think it's ended, like the last one was kind of.
So each council member gets to appoint 1 youth and 1 adult board member. So right there, that gives you, in the mayor, so that is 7-7. But the mayor has 3 appointments, and I think that the mayor can select either 2 youth or 2 adults. So it's either going to be 8 adults, 7 youth, or 7 adults, 8 youth. It just depends on the mayor's appointment.
I was thinking more like the open seats available right now and the turnaround time when it comes to processing those applications once they're in.
Okay. So if there's 2 youth seats that are currently filled, that means there's either 5 or 6 youth seats available. If there's 5 adult seats filled right now, that means it's either 2 or 3. And once again, that just depends on the way in which the mayor would like to appoint. Yeah. So applications are submitted to the city clerk's office for all boards and commissions. They then turn that around. I don't have all the data on this. They then are supposed to give that to the mayor's office, and then the mayor's office they go through a process where they may interview or do whatever it is they do to be able to make a selection, and then they bring that to city council. So with this, there's an extra step because people still have to submit applications to the city clerk's office, but then we have to then connect the dots with each council member. So there's an extra step that doesn't usually happen for most boards or commissions. So we can try next time to come back with a better timeline, but I don't know because there's other individuals involved that are not here that make those decisions about appointments.
Yeah, thank you for that, by the way. That was a great question. I probably should have written down, but we'll definitely bring back that information to you. Yeah.
So my question is, and I think I know the answer to it, but because we now have districts for our city council members. So if you live in District 2, does that mean the District 2 council member would approve you, or does it matter?
These are really great questions. And it's been a minute, but we did sit down and trying to align districts with seats and current, yeah.
Definitely, but for the record, the charter does not, and we've spoken with the city attorney's office about this, does not require that a council member in a district appoint a resident from their district. They obviously can, but they are not required. The only requirement is that there just be geographic diversity, right? And so council members do not have to, there's no requirement that if a council member is paid as District 2, that his appointments have to be in District 2. They do not. They can be in.
He's District 2.
And so there's no requirement of that. Councilmember Zepeda could appoint members that are in District 2, but he could also appoint members for various other reasons because he ran into someone and a young person that's interested and expressed that interest to him, or an adult that expressed that interest to him. And so it is still fairly broad, the requirements.
And what I just will add, and I see your hand, is that completely agree. The charter does not require that. But I will say I can see in the future, years from now, maybe when the folks who are already seated are not on the board anymore, I can see where elected officials may want to make a decision to, recommend people from their own districts, because then that will give us that geographic diversity if they do that. But I do strongly believe and hope, and we would advocate for this, that for those of you who are already seated, right, you live wherever you live, and what we're trying to do is try and get as many interested people, youth and adults, from wherever in the city. We're trying to get a really nice stack of applications to help the city council members fill whatever seat that we believe they have vacant. So they have individuals to select from. So that's what we're hoping to do with our outreach, to give them some help and assistance. And you still had your hand up, yes.
So my final question is, let's say somebody submits an application, how does that application then go to a particular city council person? I mean, where does it go? Once it goes to the mayor's office, does the mayor give it to the city council person to decide, or?
So historically, LaShawna, you can correct me if I'm wrong on this. What happened is that I think initially when you all were appointed, there were a collection of applicants, and the council members had access to all of those applications simultaneously.
Yes.
So there was no kind of asymmetric information, like they went to the mayor first, and then this council person, and this council person. All the council members, including the mayor, had access to all the applications. And then based on their preference or desire, they said, oh, I like Guadalupe and Yana, and I like this person here, right? And made those recommendations. And so they were all provided the information at the same time.
Yeah, that's exactly what happened. And so just say we were able to we do all this outreach and we get 50 applications that are submitted, 25 for youth, 25 for adults. We will turn all of that over. Last time we did it, where they had access electronically to all of them, they could look at them. They could select somebody from that list that they thought was great, or they could select no one and then go say, I know an individual that I want to recommend, and now I'm going to ask them to submit an application. So our role is just to help get people interested to sit on this board, and then we will turn over the application or ask people to submit applications via the process.
Okay, and I think my next question is based on that. Like, are we waiting around to have a stack of applications, or as they concurrently come in?
As they come in, because we don't we're just trying to get people to know about this board and then apply. People then submit applications not to us, they submit them to the city clerk's office. So if the city clerk's office tomorrow gets 5 applications for the Richmond Fund for Children and Youth Oversight Board, they then turn around and submit those 5 to the mayor's office. And so what we have to have this conversation with the mayor's office, which is what we did last time with the then mayor, to say, this is what's going to happen. Here is the process. This board is a little different because of the charter language than any other board or commission, where usually the mayor gets to appoint by him or herself. This one, that's not the case per the charter. So we have we need to have a meeting with the mayor's office to make sure they understand what the charter language says that allows other council members to make appointments, but still the mayor's office at the end of the day has to put those appointments on the city council agenda. So that at the end of the day, so council member A will say, here are my 2 appointments, mayor. The mayor then has to put those items on the agenda for the full city council to vote on. I don't know if that helps. And we can do some sort of flow chart maybe at the next meeting to explain, and that'll give us some time to have a conversation with the new mayor's office. Because we have not received any applications, so we have not had this opportunity to have a conversation with the new mayor's office so they understand what happens when they receive applications. But that's what we will do prior to our next meeting and do some sort of flow chart to show what that looks like.
Do you have a way so that if somebody has an interest, but they're not sure, they don't know, maybe where you can say, oh yeah, we're here, you can call us, we'll help you fill out the application if you want? Are you going to have somebody available to help?
So I will say that, as I think Guadalupe alluded to, in the outreach, there will be outreach materials, and there's contact information on the flyers and the information that we'll share. And what we can do, and we could do this tomorrow, is send over to all the board members what that flyer or that information looks like, and we'll also share maybe even things with you that you might be able to post on your social media if you wished. So if you identify, hey, send me what I could post on Instagram or my Facebook, like Abdul could share some stuff with you to assist with publicizing. And on that information is contact information and email, and encourage anybody interested in applying or wanting additional information to reach out to us.
Yeah, and I'll add too, in another commission we have with the Reimagining Public Safety Task Force, I think we had someone who was interested and was going to apply and attended a few of our task force meetings just to observe and ask questions to current ones, so that's also an option. Folks can come and see how we run our meetings, or they might, if you all are interested, maybe they could talk to you as well, and do, maybe a Q&A as well. So there's many ways.
And is there a possibility that we might, at these tabling events that we're doing, have like a sign-up sheet, with, if somebody's interested, they could, then we're reaching out to them, not necessarily having them reach out to us. So just like, if you have an interest, we can send you an email, we'll touch bases with you, and just kind of have a feel for them to where we're reaching out. Because I think it's sometimes it's like, yeah, I want to do it, but then it ends up, back in the back of my mind. But then if we're, continuously like, here's the link to the application. If you have questions, we'll walk you through this. So I think that's a suggestion.
I love that idea.
Yeah.
Yeah.
That'd be great.
Abdul?
Yeah, because I know
Tomorrow.
Currently at the events that we go to, we have, like he said, the outreach materials we have with the phone number and the email on it, but just a more proactive route to it would definitely provide some better results, it seems like. So we'll add that to the list of
A
things
sign-up
to do.
sheet, we like it. We're going to create one.
Yeah.
We're going to create one, and that way people know you sign up here, we will add you to our email distribution list, and we can provide them with information. Thank you.
What's the stipend amount again for the youth?
It was 60?
$50
Oh,
per
50.
meeting.
Yeah.
For youth.
For youth.
I'm going to just clarify that.
50, 50.
50 up to 600 in a year, depending on how many times we meet.
Yes. With a $50 per meeting for youth board members, which is defined as those board members 15 to 24, and it's an annual cap of $600 per year, and that's just to prevent the young people having to file taxes. So we don't want to pay them and then create a burden on a young person that may not anticipate that during tax season they might have to report on these. So it's a stipend. Yep.
Oh, and I just want to add that when we do go out to these community events, what we're also doing is making sure we're having other information. We have this, thank you to Abdul, we have this one pager about community services, because that's our one outward facing department, where there's QR codes, links, where people can go visit about ENT, recreation, our libraries. So we're telling folks about our FCY, Oversight Board, all the great work, grants, but we're also saying here are resources, or here's information that you can go collect and learn about to talk about how do you get job training, how do you learn about youth works. We have all these libraries, like we're trying to do some information sharing at the same time when we go out, when we have opportunities to table. So I just want to let you all know that as well.
All right, anybody have any more questions? Abdul, you gonna give us the goodies now or later?
This is the last agenda item, so we're good. So you're welcome to adjourn.
Wait, before we adjourn, are there anyone here for public comment? Sorry, just have to do it. I don't see anyone. Thank you so much.
Thank you, LaShonda. Okay, there's no further comments or questions. We are going to adjourn this meeting at 8:16. Dang, wait for it too, huh? 8:17 p.m.
Thank you.